Today, we will be discussing atopy in dogs. What is atopy? It is an allergic skin reaction caused by an allergy to substance in the environment or food that triggers the immune system to react to things that is otherwise normal, such as grass, pollen, dust, mold, specific protein, wheat, eggs, and more. Typically, dog developed atopy after 1 year old, and the symptoms are likely to be something the owner needs to deal with for the rest of the dog's life. Atopy is the second most common allergic skin condition in dogs, with flea allergy is the more common. We will discuss atopy symptoms, diagnosis, and treatment in this video. Before we dive in, some disclaimer here that I am not a vet, and you should always consult with your vet for correct diagnosis or treatment. All information presented in this video are information we learned along the way when trying to treat our dog Jimmy's itchy skin problems. Jimmy started to develop allergy symptoms when he was over 1 year old, and it took us months to figure out what is going on and what to do about his itchy skin problems. Symptoms of atopy usually begin relatively early in life, often by 1 year old. Symptoms usually are seasonal at first, with most dogs showing clinical signs in summer months when airborne allergens are presenting higher concentration. As atopic dogs age, their symptoms tend to become less seasonal as they become allergic to more substances. Dogs with atopy are usually itchy, particularly around the hands and feet, their paws. Your dog will constantly licking the hot spot until it bleeds. The hot spot will be red and irritated due to scratching and excessive licking. Ears may also be inflamed, so you will see excessive of head shaking. The symptoms of food allergy is very similar to atopy, so it makes the diagnosis challenging. What to look for if your dog has atopy: chewing at the paws, scratching the muzzles or rubbing it on the ground or with paws, scratching or rubbing ears on the ground, excessive shaking the head. It is critical to know the underlying cause of the itchy skin to provide long-term care for your dog. While the vet might prescribe you steroid or anti-inflammatory drugs, which will help alleviate the symptoms in the short term, as a responsible owner, we should be our dog's guardian and find out the underlying cause of the skin itchiness. One of the most common causes of allergic skin disease is flea bite, so check your environment and observe your dog's skin to see if there is any flea or flea dirt present. Also, you should have a flea and tick prevention plan in place to protect your dog from flea and tick. There are topical pills or color options for flea and tick control, so check with your vet and see what makes the most sense for your dog. Food allergy could cause itchy skin symptoms, and as with atopy, dogs with food allergy often chew on their feet, rub their faces on the floor, and scratch their ears. The symptoms of food allergy are virtually the same as to those caused by environment. One important factor to consider is that atopy symptoms usually begin in dogs between age 1 to 4 years old, while food allergy can develop at much younger or older age. Allergy caused by environment normally will start in warmer months and quiet down in colder months. Keep those in mind when trying to diagnose the cause of itchy skin. The vet can only help so much, so as an owner, you will need to pay attention to your dog's environment and keep close track of his symptoms and whether there is any change in his environment to cause the symptoms better or worse. There are also allergy tests available, but those are pretty pricey, depends on where you are getting them from. Many times, severe skin itchy and inflammation is caused by allergies to fleas, food, or environmental substances. By conducting allergy tests can determine exactly what your pet is allergic to. It will allow the vet to provide more effective treatment. For pollen, dust, and mold allergies, it allows for the possibility of treatment with allergy shots or allergy drops. They also called immunotherapy or desensitization, which help to decrease the immune system's overreact response to these otherwise unharmed substances. Allergy testing is done either with a blood test or with skin testing, where a technician will clip a small portion of hair and inject common source of allergy substance to see if the skin has reaction to the injection. Talk to your vet about which test is better for your pet. There are a number of ways to alleviate the symptoms and make your pet as comfortable as possible when symptoms flare up. If you have successfully ruled out flea and tick allergy by performing a strict flea and tick prevention routine, and you have also ruled out food allergy by doing an elimination of diet plan, but your dog itchy skin problems still persist, then the cause is likely to be environmental. Unfortunately, it is almost impossible to avoid things in the air. If you have done an allergy test and know what exactly is the cause, you might be able to reduce contact with a specific substance. For those who don't have the budget or resource to conduct an allergy test for your pet, there are two primary forms of treatment for allergy: drug treatment and immunotherapy. The ideal treatment for most moderate and severely affected pets are a combination for both. Drug therapy relieves the symptoms of atopy, but does nothing to treat the underlying allergy itself. The vet might prescribe you types of steroids or antibiotic when the skin has severe infection. Those drugs will suppress the whole immune system to fight off the flare-up of the allergy, and those drugs should only be used for short term. There are also side effects for those drugs. For steroids, because you are suppressing your pet's whole immune system, it might make the already damaged skin more susceptible for a second infection. Talk to your vet about the dosage and side effect before you administer those drugs to your dog. The other type of treatment is antihistamine pills, kind of like human allergy pills. There are a lot of branded names, including all those. I cannot pronounce most of them, so I am listing them on the screen for your information. There is also Apoquel, which is not a steroid, cyclosporin, or antihistamine. Apoquel is specifically designed to address the source of the itch, providing fast-acting relief within 24 hours after taking the pill. Cytopoint is a monthly injection that provides relief from itchiness. Cytopoint needs to be kept cold, so it will need to be administered at a vet. Typically, Cytopoint injection provides itch relief for 4 to 8 weeks. There is also immunotherapy options if you conduct allergy tests. Basically, the goal is to start to introduce a small amount of allergens and the dosage gradually increased. It will take at least 3 to 6 months or longer before you see any results, and during the first few months, you likely still need to use antihistamine or other medication to curb the symptoms. It takes time and effort to find out what is going on with your pet when they have itchy skin. It took us months to go through a long elimination process until we confirmed that Jimmy is indeed allergic to environment. We did not conduct expensive allergy tests, so we still don't know what exactly is bothering him, but at least we know it is not food or flea and tick, and can focus on long-term treatment to curb the symptoms when it flares up. I hope you and your pet can all stay healthy and safe. If you are looking for tips for raising a happy dog, check out the video on the screen to learn more. Thank you, and I will see you next time.